Behavioral Sciences Lecture 4 Cognition, Consciousness, and Language. What is cognition? Cognition is the ability of our brain to process information. It's composed of more than just conscious thought and awareness, though. This is especially prevalent and noted when we're asleep. Even though we're not conscious, we're still dreaming, which means that we're still undergoing some cognitive function. The general consensus with cognition is the information processing model, which basically states that the brain encodes, stores, and retrieves information much like a computer. Now, mind you, this is still just a theory, but it's the one that most psychologists go off of. Before we go into cognition as a whole, let's go into some cognitive development. Piaget stages is the accepted progression of cognitive development. It starts off with the sensory motor stage, which focuses on manipulating the environment to meet physical needs. This is roughly from birth to about age 2. The hallmark of the end of this stage is the revelation of object permanence. I'm sure many of you have seen infants before and have played peekaboo with them. The reason why this is so exciting to this infant is because that child is unable to recognize that an object that disappears is still there. Once they can recognize this, they go into the preoperational stage. The preoperational stage focuses on symbolic thinking, egocentrism, and centration. They can make believe, they can pretend, which is very different than the sensory motor stage. They're also egocentric. They can't really think about anything other than themselves. This goes from about age 2 to 7. Following the preoperational stage is the concrete operational stage, which focuses on understanding the feelings of others and manipulating physical objects. This goes from about age 7 to 11. Lastly, there's the formal operational stage, which focuses on abstract thought and problem solving. This goes from ages 11 and over. There are many biological factors that affect cognition. Brain disorders, or abnormalities, can change the way we think and perceive the world around us. Genetics is how we are born. This obviously structures how our cognition affects us. Chromosomal conditions refer to the expression patterns of our genetic makeup. These will alter our cognition and cognitive functions as well. Metabolic derangements. These are the result of issues with our metabolism or diet. Lastly, drug use. Taking in external chemicals will alter how our body functions. Obviously, this will have some effect on our cognitive functions as well. Do note that some cognitive decline is normal with aging. Attention. There are two types of attention. The first is selective attention, which basically allows people to pay attention to particular stimulus while determining if the additional stimuli in the background requires attention. Basically, you look at a stimulus, see what's around it, and determine if whatever the background is worth paying attention to. Divided attention uses automatic processing to pay attention to multiple things at once. Now note, some people are better at this than others. Problem solving and decision making are an integral part of our cognition. Let's go ahead and look into it a little further. Mental sets are patterns of approach for a given problem. An inappropriate mental set will obviously negatively impair the problem-solving ability. There are different types of problem solving. The first is trial and error. Long story short, it's try and repeat. Basically, you propose a solution, attempt it, see if it works. If it doesn't, back to the drawing board. The next are algorithms. These are formulas or procedures that are either predetermined or something that you've learned in the past to solve a problem. In math, these would be equations. Deductive reasoning is deriving the conclusions from general rules or observations, while inductive reasoning is deriving generalizations from evidence. The scientific method largely revolves around inductive reasoning. Decision making. There's a couple factors that go into decision making. The first are heuristics. These are shortcuts or rules of thumbs used to make decisions. Generally, these are based off of previous experiences or learned behaviors. Biases exist when an experimenter or decision maker is unable to objectively evaluate information. Everyone has their share of biases, but it's important to make sure that you're aware of them. Intuition. This one gets a bad rap at times, but it's just as important as the others. It's that gut feeling you get regarding your decisions. It's often attributed to previous experiences with similar situations as well. Now that we've covered problem solving and decision making, let's go into states of consciousness. The first is alertness. It's the state of being awake and able to think, perceive, process, and express information. In short, it's a full conscious awareness. I'm sure many of you are more alert than you'd like to be. The next state of consciousness is sleep, something that I'm sure many of you don't get enough of. This is triggered by changes in light, which trigger melatonin release by the pineal gland. This results in the feeling of sleepiness. Cortisol, on the other hand, triggers wakefulness, which has an opposite effect to melatonin. There are multiple stages of sleep, and depending on how these stages fluctuate, it will determine how rested you feel. Stage 1 is light sleep. Stage 3 and 4 are what's called deep, slow-wave sleep. You can dream during these stages, and the dreams focus on the consolidation of declarative memories. REM sleep, or rapid eye movement sleep, is the restful sleep. Dreaming here is focused on consolidating procedural memories, and this is also where most dreaming takes place. Sleep disorders. Dysomnias, or disorders that make it hard to sleep, include insomnia, the inability to sleep, narcolepsy, the inability to regulate when you sleep, sleep apnea, stoppage of breathing during sleep that wakes you up, and sleep deprivation, which is when you just don't sleep at all. Parasomnias are abnormalities in your sleep. These include night terrors and sleepwalking. So we've gone into alertness and sleep, but there are other altered states of consciousness as well. One is hypnosis. This is a state of consciousness where the individual appears to be in control of their normal faculties, but are in a highly suggestible state. This is used in a lot of treatment regimens. Meditation involves quieting of the mind, and it's often used for stress and anxiety relief. Meditation is a very common practice in many religions. Let's go into consciousness and how drugs alter them. The first one we'll delve into are depressants. Examples of these are alcohol, barbiturates, and benzodiazepines. They promote and mimic GABA activity in the brain. Take note though, alcohol's classification is heavily suggestive. It has aspects that make it a stimulant, but also a depressant. Usually it's classified as a depressant, but do note that it has other effects as well. Stimulants are things that otherwise increase your function, or stimulate your activity. Examples of these are amphetamines, cocaine, and ecstasy. They increase dopamine, norepinephrine, and serotonin concentrations at the synaptic cleft. So, long story short, these make you feel good. Opiates and opioids. Examples of these are heroin, morphine, opium, and prescription medications. Do note, these can cause death by respiratory depression. Also, many of these drugs are taken intravenously, so other health complications can result from these. Hallucinogens alter your perception. Examples of these are LSD, peyote, mescaline, ketamine, and mushrooms. While these things have led to the creation of very amazing art and music, they do have deleterious effects to your health. Lastly, marijuana. This is hard to classify because it has depressant, stimulant, and hallucinogenic effects. Currently, it's a huge political and medical controversy. There has been shown to be benefits to medical marijuana, but it's still under discussion. Let's go into a little bit of language. There's a lot of different areas in the brain that affect various regions and various functions, but there's two that are mainly tested on the MCAT. There's the Broca's area and the Wernicke's area. Both of these influence speech and language. Let's delve into the first one. Broca's area controls the motor function of speech. Damage to this area results in Broca's aphasia. which is the non-fluent aphasia with a lack of comprehension. Patients that suffer from Broca's aphasia generally have a reduced or absent ability to produce language, even though they can otherwise read. Wernicke's area controls language comprehension. Damage to this area causes Wernicke's aphasia. This is marked by the inability to repeat words despite intact speech generation and comprehension. Patients that suffer from Wernicke's aphasia generally speak nonsensical sounds and inappropriate word combinations without meaning. It's often frustrating for these patients because they think they understand perfectly well, even though people around them have no comprehension of what is being said. So that'll do it for our 4th lecture. Please join us in the next lecture.